death toll of children from diphtheria has risen to 19 at a municipal hospital in Delhi. In the last 18 days, 19 children have died due to non-availability of the antitoxin serum in hospitals. North Delhi Mayor Adesh Gupta set up a panel to look into the death cases and sought a report within 3 days as well. Meanwhile, sources from within the health ministry say that it is the hospital that is responsible for these deaths and that they should have kept inventory and stocks ready.
जिन बच्चों की जाने गई उनके लिए बड़ी दुख संवेदना प्रकट करता हूं और उनके परिवारों के साथ। लेकिन मैं एक बात और कहना चाहता हूं कि ये सीरम कहीं भी मैंने प्राइवेटली भी जब सर्च कराया तो पूरी दिल्ली में कहीं नहीं था। इवन हॉस्पिटल्स में, दिल्ली गवर्नमेंट के हॉस्पिटल सेंटर, क्योंकि ये सीरम कोई भी रखता ही नहीं है। लेकिन अगर हमारा वो हॉस्पिटल में संक्रामक इस तरह के पेशेंट आने की उम्मीद थी तो प्रशासन को, अस्पताल प्रशासन की जिम्मेदारी थी कि उनको इसका इंतजाम पहले करना चाहिए था। मैंने पहले भी कहा कि जो मेरे लेवल की काम था, मैंने 2 काम, एक तो उनको वायल दिलवाना था, इंजेक्शन दिलवाना था, और दूसरा प्रशासनिक रूप से या चिकित्सीय रूप से जो लापरवाही होगी उनको सजा जरूर मिली। हर साल डीपीटी के पेशेंट आते ही हैं। ये सब जांच का विषय है कि क्या इसमें कहाँ किसने गलती की, वो मैं आपसे पहले ही कह चुका हूँ। इसमें कोई भी प्रशासनिक और चिकित्सीय लापरवाही में कोई किसी को बख्शा नहीं जाएगा।
Let's in fact go across to Milan Sharma joining me on the phone line. Milan, what are the latest details you're picking up as far as this entire issue is concerned? The serum, the antitoxin that is needed, is that now available for all those who require it?
Well, yes, right after the intervention of the Union Ministry of Health, the serum was made available. Almost 200 vials were sent immediately to the hospital. However, the latest update from the hospital is that now another death has occurred due to diphtheria. And as said earlier, the antidote, which is the antitoxin, has to be given within 1 to 2 days of the diagnosis, because otherwise, it could turn fatal for these children. And since it's not administered in time, the patient can also die. And hence, we're looking at another death toll. Now, 19 children have died of diphtheria in the national capital in this particular hospital of Maharishi Valmiki, where earlier the antitoxin serum was not made available on time.
Right. And Milan, as far as the health ministry sources are concerned, they are telling you that it is the responsibility of the hospital and they should have kept the antitoxin ready with them. But is that fair? Because from what we understand, the toxin is not available very easily.
Yes. This is what the hospital authorities had tried to say earlier, that the place that they source the toxin from, which is in Kasauli, the Central Research Institute, was under renovation till July 2018. However, when we spoke to the director of the Central Research Institute, he insisted that the antitoxin was ready with them 15 days prior to the entire demand that was raised by the Municipal Corporation Hospital, and that the essential vials were not picked up on time, and which is why there was a delay, and hence the poor children who are suffering from diphtheria died because lack of antitoxin, and that was not given to them on time. And yes, so the Union Home Ministry, the Union Health Ministry, has said that it is the responsibility of the hospital to maintain the stock of the antitoxin.
All right, Milan, thanks for getting us those details.